Make sure you tune in as well for Good Morning America Weekend, which debuts tomorrow morning, 7 o'clock. Melanie?
All right, Art. And now to the other big story we're covering today, the latest on President Clinton's heart condition. Eyewitness News was the first to tell you that the former president will undergo a quadruple bypass. After complaining of chest pains for several days and shortness of breath, some initial tests were done. They all turned out normal, but an angiogram found blockages in the arteries of his heart. So doctors have recommended quadruple bypass surgery. His wife, Senator Hillary Clinton, says the president is remaining upbeat.
Excellent hands, and he's at one of the great hospitals in the world, but I'm going to leave now.
ABC News has learned that the former president will undergo that quadruple bypass tomorrow. Well, since leaving office, President Clinton has lost weight. He even went on this popular South Beach diet, but he has struggled with his weight in the past, as you'll remember. During his presidency, in fact, he had a real reputation for eating fast food. A medical report in 2001 showed he had an above normal cholesterol level and a borderline high blood pressure.
Bypass surgery is fairly common with a high success rate and a low risk of complications. Health Check's Christy Myers joins us now with much more on a procedure that was invented right here in Houston.
Art, that's right. The first heart bypass surgery in the world was performed at Houston's Methodist Hospital. Dr. Michael DeBakey, who is now 95, did that first heart bypass in the 50s. The procedure has saved countless lives, and tomorrow that will include the life of a former president.
The heart bypass was actually invented in Houston by Baylor heart surgeon Dr. Michael DeBakey. Dr. George Noon worked with DeBakey for decades, and now Noon is one of the country's leading heart transplant surgeons. He says Clinton faces a serious surgery tomorrow, but Noon expects him to do well. Even though at 58, Clinton needs a quadruple bypass much earlier than most patients.
Well, it is young to have quadruple. I mean, there are those in their 30s, but most of the people that we operate on are in their 60s or older.
Dr. Noon even knows the surgeon who will operate on Clinton.
From what I understand, Dr. Craig Smith, who's the head of cardiac surgery at Columbia, will be doing the operation.
President Clinton reportedly has narrowing similar to this in 4 vessels that feed the heart.
Would that be enough to cause pain?
Absolutely, yes, yes. Because what happens is not enough blood flows to the heart muscle further downstream, and then there's not enough oxygen, and that causes pain.
In bypass surgery, surgeons remove the narrowed area and take a new vessel, usually from the leg, and attach it to the aorta, basically bypassing the diseased vessel. Could the stress of being president contribute to the need for bypass surgery?
That stress can affect problems that are already in the heart, but I don't think stress in itself is going to cause a heart problem or the coronary artery disease. And so the diet would have more to do that, and maybe genetics.
At 6 o'clock, we'll find out what it's like for the heart surgeons who regularly perform heart surgery on celebrities. Reporting live, Christy Myers, 13 Eyewitness News.